Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Genetic syndromes which are associated with the aortic aneurysmal diseases. So the first disease we are going to see is the Marfan syndrome. So under the Marfan syndrome, the code is, it is also known as the MFS. In short, so the gene mutated is the FBN1. So FBN1 is the gene which is mutated. Now talking about the aneurysm. The aneurysm is the dilation of the aneurysm of the aortic root. So this dilation of the aneurysm, and this is of the aortic root, A root, and there is dilation of the pulmonary artery. There is dilation, and this is of the pulmonary artery. So this dilation of the pulmonary artery and the dilation or dissection of the descending thoracic. So there is dilation or the dissection of the descending thoracic, as well as or the abdominal aorta. So this was about the Marfan's. Now let's jump to the Ehlers-Danlos. So Ehlers-Danlos syndrome is nothing but the EDS. It stands for the Ehlers-Danlos syndrome. So to be Ehlers-Danlos. So Ehlers-Danlos syndrome. So here looking at the gene mutated, there are several genes which are mutated. So there is col 5A1, then 5A2. So col, there is 5A1, there is 5A2, as well as there is col 3A1. So 5A1, 5A2 and 3A1. Now when you look at the aneurysm is going to be arterial mid-sized rupture. So there is going to be arterial mid-sized. So there is arterial mid-sized rupture. So there is presence of arterial mid-sized rupture, and especially it involves the thoracic or the abdominal vessels. So it involves the thoracic or the abdominal vessels. So the mid-sized rupture, and specifically involving the thoracic or the abdominal vessels, and frequently the descending as well as the abdominal aorta. So it includes the descending as well as the abdominal aorta. This is seen in high frequency. So we saw about the Ehlers-Danlos. So the genes mutated there was col 5A1, col 5A2, as well as the col 3A1, and arterial mid-sized rupture, especially involving the thoracic or the abdominal vessels. So now we look at the LDS. LDS stands for the Loeys-Dietz syndrome. Loeys-Dietz syndrome. So Loeys-Dietz syndrome is commonly known as the LDS. So the genes mutated here includes the TGF-BR1. So TGF-BR1, then you have the TGF-BR2. So TGF-BR1 and then TGF-BR2. So what is the aneurysm here? So here it includes the premature and the aggressive aneurysms. So there is premature as well as the aggressive. So there's premature, aggressive aneurysm, and the dissections, the premature aggressive aneurysms and dissections. Next is the aneurysm distal to the aortic root. So then there is aneurysm which is distal, aneurysm distal to the aortic root, A root. Then next we move on to the FAAD. So what is the FAAD? So FAAD, it stands for the familial aortic aneurysm. So familial aortic aneurysm as well as the dissection syndromes. So here there are again several genes such as the TGF-BR2. Then there is MYH11 as well as ACT82. So there's TGF-BR2, MYH11 and ACT82. So all these are the familial aortic aneurysms or the dissection syndromes. Next, what are the aneurysms which are seen? So aneurysm seen are, there is nothing but there is the ascending aorta aneurysm. So there's the ascending aorta aneurysm as well as the dissection. Next is the bicuspid aortic valve. If bicuspid aortic valve is the gene mutated is unknown. It is unknown. And let's look at the type of aneurysm. So the type of aneurysm is that there's aortic dilation, typically involves the aortic root. So there is aortic dilation. If you see, there's aortic dilation, and this typically it involves the aortic root. So it involves the aortic root and also the ascending aorta. So it involves aortic root as well as the ascending aorta. And whereas it is not present in the descending or the abdominal aorta. So it is not present in terms of the, it is not present in the descending. So this is important to note. So the bicuspid aortic valve, the aortic valve typically involves the aortic root and the ascending aorta, whereas it is not present in the descending or the abdominal aorta. This is the specialty of the bicuspid aortic valve. So we finished the BAV. Next we move on to the ADKPD, ADPKD. So ADPKD, it stands for the autosomal dominant polycystic kidney disease. So the gene mutated will be the PKD1 as well as PKD2. So what does it involve? It involves the dilation of the aortic root and the dissection of the thoracic aorta. So this is dilation of the aortic root. So dilation of the aortic root as well as you dissection of the thoracic aorta. The dissection of the thoracic aorta. Now we move on to the Turner syndrome. So looking at the Turner syndrome, there is the gene mutated will be the 45X. And what is the aneurysm which is involved? So the aneurysm involved is nothing but the thoracic aorta aneurysms as well as the dissection. So the thoracic aortic aneurysms as well as the dissections. So they are the ones which are involved. Next we move on to the neurofibromatosis. So how is the neurofibromatosis? So neurofibromatosis, the gene mutated is going to be the NF1. And what will be the aneurysm here? So when you look at the aneurysm, it is going to be the aneurysmal arterial diseases. So aneurysmal arterial diseases, and this affects the abdominal aorta. So it affects the abdominal aorta. To learn and grow daily like this, please do subscribe.